Hi, I'm Patty Brader, one of the members of the RCPA Conference Committee, and I'm here to introduce Tanya Dyson from Devereux Advanced Behavioral Health, one of our exhibitors and sponsors. Tanya, would you like to tell us a little bit about Devereux?
Sure, thank you, Patty. My name is Tanya Dyson. I am Director of Business Development here at Devereux Advanced Behavioral Health. Devereux is one of the largest providers of behavioral health care in the country. And we were originally founded in 1912 by Helena Devereux, a former public school teacher in Philadelphia. Since 1912, our program has expanded and our lines of service have expanded, and we now serve individuals and families and the community in the areas of autism, intellectual and developmental disabilities, specialty mental health, education, and child welfare. We offer several lines of service, from acute care to psychiatric residential treatment services, to foster care, to community-based outpatient and other specialty services, education, foster care, did I say that? And other lines of service. We also are especially proud that we have for a long time served the LGBTQ plus community. As part of our background, Devereux has served a diverse population throughout the years, and we are proud to have been recognized by the Human Rights Campaign as one of the supporters of the LGBT plus community. In fact, in 2020, 10 Devereux centers were recognized by the Human Rights Campaign for being supporters. Recently, Devereux has adopted the American Psychological Association's gender affirmation model for the clinical approach towards serving the transgender and gender expression community. So we're very, very proud of that. Is there anything specific that you'd like to ask, Patty?
Where are you located, Tanya?
Well, we're incorporated out of Villanova, Pennsylvania, which is where we began in 1912. Since then, we've moved into 13 different states. We're in California, Colorado, Massachusetts, Connecticut, New York, New Jersey, Florida, Georgia, Texas, and Arizona. So we're very vast we're very much located throughout the country and serve all different levels of care and reach all different populations.
Could you tell us a little bit about how COVID has affected your operations this year?
Absolutely. Well, first and foremost, Devereux's primary concern is always the safety and well-being of the clients and their staff. That said, we have had infectious disease protocols in place for a long time. We have the emergency management plans that are in place. And then when COVID came along, we specifically geared the program, the planning of those to COVID-related services. COVID-19 planning and response task force that's been put into place. And we did have to stop some of our in-person visitation and our face-to-face services, but we immediately began the telehealth. And our telehealth related services have expanded exponentially. In January and February, we served perhaps 6,500 families in telehealth related services. In March alone, we served 20,000 tele-related services and provided. And from January through June, we've provided an average of 23,000 per month of tele-related services. So I think essentially Devereux pretty much covers every entity that we possibly can in the behavioral health care field. And we look toward partnering with our CPA and serving the community and the families that they represent also.
Well, that's great, Tanya. It sounds like Devereux has really stepped up to the plate for their clients and providing the services during this really difficult time for everybody.
Yes.
Is there anything else you'd like to add?
No, I don't think so. Just that I hope that you will make inquiries into Deborah if you have any questions about any services, anything we can help with in the behavioral health care field. We'd be glad to do so and to partner with other organizations. Thank you.
Thank you, Tanya.